I'm going to talk about sinus rhythms. So we'll classify as anything as a sinus rhythm is basically just the P wave, and that it's upright, normal, rounded P wave, and it's before each QRS complex. So we have a few different types of sinus rhythms. So they're pretty much exactly the same if we look through our 5-step method. So the regularity, it should be regular. The rate is the only thing that really differentiates the 3 different ones that we have. So in our sinus rhythms, the atrial and ventricular rates will always be the same. A normal sinus rhythm is between 60 and 100 beats per minute, and you'll notice that this is the same rate as our SA node intrinsic rate. If it's less than 60 beats per minute, we call this sinus bradycardia, and if it's greater than 100 beats per minute, we call this sinus tachycardia. The P wave, like we said before, will always be upright and rounded, and before each QRS complex. The PR interval should be consistent and between 0.12 and 0.2 seconds, and the QRS complex will be less than 0.12 seconds because it's originating from the SA node. Now, we do have another type of sinus rhythm which is called sinus arrhythmia. The only thing that's different about this is the regularity. It will be irregular. This is because changes due to like breathing, and it can just be normal in some people as well. Rhythm. So first step in our interpretation is to work out regularity. So if we take our two R to R complexes, they look pretty regular. They don't look like they're different in any way. So we're going to say this rhythm is regular. Then we'll calculate rate. So we find one that's on a bold line or a big box, and I'm going to do my countdown method. So the first one is 300, 150, 100, 75. So we're going to say this rhythm is approximately 75 beats per minute. Then we'll look at our P waves. So all of these P waves, they look the same. They're upright, they're rounded, and you can see that they're before each QRS complex as well. Next thing we'll look at is the PR interval. So remember, this needs to be less than 5 boxes. So we can see here there's about 1, 2, 3, 4 boxes. So we can say this is a standard PR interval, and they are the same across all of them as well. If we look at the QRS complex, it's about 2 boxes. It's sharp, narrow, so we can say this is less than 0.12 seconds. So our interpretation of this is it's a sinus rhythm because we have that P wave before every QRS complex, and we can say that they cause the QRS complex as well. The QRS complex is narrow. Then if we look at our rate, we can determine if it's normal sinus rhythm, sinus tachycardia, or sinus bradycardia. Now, because it was a rate of 75, that's between 60 and 100, so we'll say that this is a normal sinus rhythm at a rate of 75